Hello, it's Dr. Erica again. Thank you for joining me on this particular video. I'm going to talk about, thank you for joining me. I'm going to talk about hepatic metabolism, pharmacokinetics branch of the pharmacology. And this particular video talks about metabolism. So after absorption through the stomach lining, through the intestines, the medication is going to be distributed throughout the body. And then it's going to be distributed either largely or small because of the plasma protein binding and tissue binding, which can be fat tissue, muscle tissue, organ systems, for example, that I've mentioned previously. Also, after distribution, we meet metabolism. So after metabolism, the medication will go through excretion after metabolism. So we're at metabolism right now. And I want to mention that the hepatic metabolism helps to dissolve the medication, bring more water into the drug that was initially taken through by mouth. So the hepatic metabolism will help break that drug down. Once it's broken down, it either becomes inactive form or it becomes inactive and active, or it becomes still active. So hepatic metabolism is very, very important. Liver functioning is very, very important when it comes to determining a drug's metabolism um, form. So now there are proteins called cytochrome P450 that also affects enzymes that primarily are responsible for drug inactivation in the liver. So the liver functioning is very important. A good liver goes a long way. Okay, so once the liver functioning decreases, medications can't be excreted properly. So with the enzyme family of cytochrome P450, this helps to break down the medication again so that it can be excreted. Now, some medications are reabsorbed through the liver, and so once that happens, that means that the drug is reabsorbed through the liver and it still remains active. Okay, so it goes to the liver a second time, and then it becomes excreted, or it becomes more broken down at that particular point. Now, the intestinal inactivity of the drugs by the enzyme family in the gut is responsible for reducing the free amount of drug in the body. And that occurs for a number of drugs. Again, I'll say that again. So the intestinal inactivation, the intestines itself, the large intestines, the small intestines, inactivation of drugs by protein or enzymes in the gut is responsible for reducing the distribution of a number of drugs. So sometimes we get metabolism at the lining of the intestine, at the lining of the stomach. Remember, I mentioned that absorption is not 100%. Absorption may be a small fraction or maybe a large fraction, depending on the drug itself and the biology of the particular individual. If an individual has lots of enzymes, they produce lots of enzymes in their body, then the number of free drug will be decreased. The metabolism of the drug may be high, so the drug may not last as long in the body. Okay, so to be aware of that, the older a patient gets, or the older geriatric patients get, the weaker the liver becomes, the weaker the enzymes that help to break down these drugs become. And so medication can build up in the bloodstream and become toxic rather than therapeutic. So do be mindful of that. Again, metabolism plays a huge part of elimination, breaking down of a drug through the liver, through enzymes, and also its overall bioavailability as far as toxicity and therapeutic production. So thank you for joining me for this particular video. Like, share, and subscribe. Take care. Bye-bye.